tumor called the epidermal inclusion cyst. It is that hair follicle which is there in the epidermis that gives rise to this important cyst called epidermal inclusion cyst. It contains a lot of lipid material. You can see how the epidermal inclusion cyst typically looks like beneath the ear. So this is one important area where hair follicle can give rise to this inclusion cyst. So this is a typical 38-year-old man with the development of a plantar epidermal inclusion cyst which is developing on the 5th metatarsal bone. And this coronal T1 weighted image, you can classically see that mild enhancement of this mass which is the epidermal inclusion cyst. And this is how the T1 weighted and the T2 weighted images can show clearly the presence of an epidermal inclusion cyst. Now let us talk about another cystic lesion called pilar cyst, which is otherwise called ven. So typically it is the scalp on which this pilar cyst will be developing. It is also similar to the epidermal inclusion cyst. Only thing is there are two differences. There is no stratum granulosum layer in the cystic wall, and there is no laminated keratin within the cyst, unlike the inclusion cyst. Except for those two differences, typically scalp is the area where the pilar cyst will be developing is what need to basically remember. Let's once more get into the high yield zone. The seborrheic keratosis is one important topic, and malignant melanoma and porphyrias. Let us be the masters in these three important topics, doctor. Before that, what is this vitiligo? The area of the depigmentation because of autoimmune destruction of the melanocytes is basically called the vitiligo. Now let's talk about seborrheic keratosis. Basically, seborrheic keratosis will be developing from the epidermis. A benign epidermal tumor is a seborrheic keratosis. In the middle-aged individuals, it will be developing from the skin. It is a raised pigmented lesion which has got a verrucous surface is the seborrheic keratosis. Why you need to worry about this seborrheic keratosis? Sometimes sudden appearance of a lot of seborrheic keratosis is called sign of lesser trallat is something which you should not forget. Sign of lesser trallat is indicative of an internal malignancy. An elderly individual suddenly develops a lot of crops of seborrheic keratosis. Think of the possibility of an internal malignancy is what I want to underscore to all of you. Histologically, seborrheic keratosis will contain hyperkeratosis, papillomatosis will be there, and there is an entrapment of the keratin within the epidermis. That's the reason horny cysts will be developing is what you need to basically remember. And there will be proliferation of a lot of basaloid cells leading to the development of the pigmented appearance of the seborrheic keratosis. Now you can see how multiple seborrheic keratosis are there, which is found only as an incidental finding on the back of this patient because he is not watching his back, nor his spouse probably. So please remember, these multiple scaly brown papules need not be worried because otherwise they are not bothering the patient. But if this kind of sudden appearance of multiple seborrheic keratosis happen to appear in an elderly individual, definitely it is indicative of an underlying malignancy. The close-up view of the seborrheic keratosis will give you the typical tanning with the even contour that is there for each lesion of seborrheic keratosis are basically unforgettable. So this autoimmune destruction of the melanocytes which is called vitiligo is what you can see in this classical clinical case. Let us talk about the next important condition called acanthosis nigricans. A very important condition, another important cutaneous marker to say that there is something which is an internal malignancy in the body of the patient. A pigmented skin lesion, typically in the axillae, in the neck folds, is the acanthosis nigricans. If there is any underlying adenocarcinoma of the stomach, you need to check for. Similarly, diabetic individuals also can develop this kind of acanthosis nigricans. It can also be an indicator of a benignity also, but you need to be very careful. Then what do you mean by freckles, otherwise called ephilites? Typically they are the pigmented lesions which are macular is what you need to know. What is the difference between macula and papule? Macula is not raised. So macular lesions, typically they occur in the sun exposed areas of the skin and they are not pre-malignant is what you need to basically remember. Now, why these freckles are occurring?